A few years ago, we all witnessed the pandemic. Now, at the cost of sounding indifferent, allow me to point out that the damage in the Northeast was not nearly as bad as the rest of the country. And before someone gets angry, allow me also to say this. It was not because our healthcare system is in place or because our politicians were proactive. Far from it, I will make a bold claim that some of us will find weird, but so be it. In the Northeast, especially in the hilly regions, we simply eat well and live an active lifestyle which ensures a better immune system. Does it make sense? Yes? Cool? No? It's fine. You will understand why I'm making such generic statements. As always, my name is Kalyan Dev, and in this week of Decoded, we will try to explain exactly how horrible our public health system is. And if you want to see unity in the Northeast, here is the perfect example. When it comes to the lack of specialist doctors, the 8 Northeast states are truly united. United in the sense that we have none. Yep, if you are a resident of the Northeast and need a specialist doctor, may God help you because, well, doctors will not be able to. Pursuing for months.
The village of Assam
in the 75th Independence Day.
Over the past decade, we have become accustomed to a time-tested narrative. Anything and everything that goes against the narrative that we are living in the best times, aka Amrit Kal, is simply fake news. Democracy Index? Fake. Freedom of Press Index? Fake. Happiness Index? Fake. Corruption Index? Fake. But what happens when the source is the Indian government? You see, the Health Dynamics of India, Infrastructure and Human Resources 2022-2023 report is such an official report that the first 10 pages is just people congratulating each other and thanking who else but him, Modi ji, for doing what every government is supposed to do. But once you have skipped the first few pages, the findings of this report are fascinating. If you are someone who believes the Northeast has turned into some first world region because you get 5G on your phone and can make Insta Reels, the data on doctors will truly shock you. And no, you cannot call fake news on a report prepared by the very government you love. And if you are someone who, like millions in this region, has suffered because of a joke of a public health system, then you are likely to say, I told you so. Point being, this report is not fake and we are not pushing a theory here. We are simply pointing out how bad things are to those who think otherwise. Now, with that title, we are not being unfair to rhinos. I mean, the increase in rhino population is one of the few absolutely brilliant success stories of the Northeast and especially Assam. This is simply a creative way to point out how bad the situation is. But first, allow me to explain what a PHC is and what a CHC is. And again, this is from the government report, so don't shout fake news. A CHC is a 30-bed referral unit for primary healthcare that covers a population of approximately 80,000 people in hilly, tribal or difficult areas and 120,000 in plains. CHCs function as the first referral unit or FRU for primary healthcare centers and provide specialized services. A primary healthcare center is designed as the first point of contact between the village community and the medical officer, serving a population of about 20,000 in hilly, tribal or difficult areas and 30,000 in plains. It primarily focuses on basic health services and maternal child health care. With definitions out of the way, we sat down to look at how good or how bad the situation is when it comes to CHCs in rural areas. Assam requires 704 specialist doctors in CHCs, but only 131 are currently in position, leading to a shortfall of 573. There's severe staffing gaps in Arunachal Pradesh. With a requirement of 224 specialist doctors for CHCs, the state has only sanctioned and filled 8 posts, leaving a shortfall of 216. There's doctor shortfall in Manipur as well. Manipur has a sanctioned strength of 17 specialist doctor posts in CHCs but filled only 10. The shortfall stands at 22 with 7 posts vacant. Minimal specialist doctors in Meghalaya. Meghalaya requires 112 specialists for rural CHCs but has sanctioned only 4 positions and filled them. The shortage here is 108 specialists. 0 specialists in Mizoram's CHCs. Mizoram requires 36 specialist doctors but currently has none in position within CHCs, making it one of the states with the highest unmet need. Nagaland's insufficient specialist workforce. With a requirement of 32 specialists, Nagaland has only 2 in service, resulting in a shortfall of 30 doctors for rural healthcare needs. Sikkim lacks CHC specialists. The state of Sikkim needs 8 specialist doctors for its CHCs, but currently no positions are filled, highlighting a complete absence of specialists. And no, we have not forgotten Tripura, of course. It needs a total 72 specialist doctors in the rural CHCs but only has 4 qualified medicos in service. The shortfall is 68 with no post sanctions and lying vacant. Mind you, this lack of specialist doctors at CHC levels is not just in one field or one specialty. You name it and we don't have it. Gynecologists, not enough. Surgeons, not enough. Pediatricians, not enough. Physicians, not enough. Neurosurgeons, come on now. Are you kidding? And surprise, surprise, things are much worse if we look only at tribal areas. In Assam, only 10 specialist doctors against a need of 148. Arunachal Pradesh has a shortfall of 220 specialists with only 8 doctors in rural CHCs of tribal belt. Manipur has a shortfall of 24 specialists with only 4 in position against a total requirement of 28 doctors. The state, however, sanctioned 14 posts which show the government's intent to hire doctors for those health facilities. Meghalaya has a shortfall of 112 specialists as it needs 116 doctors for tribal area CHCs. Mizoram again draws a blank here with the need of 36 doctors for the requirement of a similar number of specialists. In Nagaland's tribal belt, 92 specialists are required for such healthcare facilities but only 7 doctors are serving. A total of 11 posts have been sanctioned though. The shortfall here stands at 85. Tripura's tribal areas need 28 specialist doctors but only 2 doctors are in service with a shortfall of 26 doctors. And oh, for Sikkim, the report says this condition doesn't apply. Now, there are many ways to address the issues mentioned in the report. Some of these are rather obvious while others would require a little more effort. Here is what the government agencies can do. For example, increase requirement of specialist doctors in CHCs. Given the massive shortfall, it is of course that we need to ramp up the requirement of specialist doctors, especially surgeons, obstetricians and pediatricians within rural community health centers to bridge the healthcare delivery gap. This can be done by making rural postings more attractive through improved infrastructure and incentive. Enhance infrastructure and facilities in rural health centers. Improving physical infrastructure including essential equipment and facilities within CHCs and PHCs will support healthcare delivery and make rural health posts more appealing to doctors and specialists. Implement financial and non-financial incentives. To attract healthcare professionals to rural areas, governments can offer financial incentives such as better pay and allowances and non-financial incentives such as career advancements, opportunities and training programs. Strengthen training and retention program for rural healthcare staff. Establishing robust training and retention programs for rural healthcare staff focusing on continuous education, skill development and support system to improve job satisfaction and reduce turnover. In short, please increase salaries of ASHA workers. Maybe. All these sound good and important, but let us be honest. Suggestions are one thing, implementation is another. It is one thing to say we need recruitment. How will one recruit though? Last I checked, you cannot order doctors on Amazon, can you? Nagaland and Sikkim going into 2025 do not have medical colleges. Arunachal, Tripura and Meghalaya have one each. Mizoram also has one, but the first batch of Mizoram educated doctors graduated only last year. Manipur has 2, but for now Manipur has problems far bigger than a lack of doctors. With Assam, which has 12 colleges, is much more accessible and connected and richer, cannot take care of its quota, how do you expect smaller states to meet their quota? Do you really expect people from, say, Punjab or Kerala to take up positions in the rural northeast? And let us say someone does take a position or two, that will still be a drop in the ocean. Like most things, we have turned access to healthcare as some type of privilege and not a right. And this is why when we see headlines like these, the rich go for medical tourism. Some of the poor people sleep outside AIIMS, Delhi, hoping for treatment even if it makes them go bankrupt, and others, well, they pray. Maybe praying is after all the only solution we have.
Don't forget to like, share, and subscribe to EastMojo. For any queries, put them down in the comments section below and press on the bell icon for notifications.